There we are. We are live. So, welcome, welcome. I hope you're excited for this conversation because I really am excited to welcome Stacey Roberts, a fellow physiotherapist. You can't beat a physiotherapist. I might be biased, but welcome, Stacey, to the podcast.
Oh, thank you so much for having me. I agree. We're kind of cut from the same cloth, us physios.
Yeah, we really are. So we are moving through menopause. That's the name of the podcast. And it's the name of the podcast for a reason, because we are learning all about the challenges that women face in midlife and beyond. And so if you've ever wanted to turn the clock back and solve the puzzle of pain in muscles or joints, then to do that without surgery, without drugs, without injections, then this episode is for you, because Stacey's written this amazing book, The Pain-Free Formula. And I'm excited to delve into that book myself, I must confess. It's solving this puzzle of pain, and to do it naturally. We'll just say that. It's a long sentence otherwise. So we're doing this naturally. And, that really speaks to my values, using food as medicine, movement as medicine, and curating the thoughts that we think. And this is a fabulous formula for thriving through midlife and beyond. So welcome to Stacey. And today we're going to tackle why your body's not broken. So this is something that in midlife, we do start to feel like we're breaking down a bit, don't we? I know I have.
Oh, absolutely, 100%. And we need to try to flip the switch on that, because there are so many other things where we have advantages being at our age, not caring, giving a flip what some people think anymore, and those types of things. So I'm hoping that conversations like these can flip the script on, that our body's breaking down.
Yeah. It can certainly feel like that, though, can't it? So, my first question is, and I'm going to put this on the screen for everybody. Many women think joint pain, stiffness, and fatigue are just a part of aging. And that's not unique to women, actually, is it? But why is this not true? Because it really isn't true, is it?
No, so there's many people that go through their 60s, 70s, and 80s, even 90s, are centenarians, without significant muscle and joint pain. That doesn't mean you're not going to have any. I've written the pain-free formula, but what I mean by that is that pain doesn't control your life, right? So that you're free from pain, keeping you from doing all the things that you would enjoy doing for as long as you possibly can. So if there's, even if it's a small set of people that don't have these symptoms, we know it doesn't have to be a part of aging. Does it come along with aging? Yeah. And many times it's due to some habits that we formed in our earlier life that as we transition through menopause with the hormonal changes, those can start to catch up with us. So if we play a little defense and start to prepare ourselves for that, then we won't have the type of significant issues that we often hear going along with the menopausal changes.
Yeah, I like that idea, playing a bit of defense. It's not really in my vocabulary here in the UK, but I do understand exactly what you mean. And so we're talking about preventative measures that we can take, lifestyle measures that we can be taking well in advance of our midlife, but that it's not really too late if you only did happen to start doing these things in midlife.
No, exactly. It's definitely, any time is a good time to start. And we see this even from a musculoskeletal point of view. We see it in the research showing that, we can reverse some of the changes that are happening in our muscles and joints if we continue or even start to exercise. So, that again, that is not age related, where we're not going to get benefit from exercise if we start later, or benefit from moving, or even some of the other things that we might talk about today. We can get benefits going all the way up until, until well into our, 80s, 90s.
Yeah, I like the sound of that. So, what sort of preventative strategies can we be thinking about when it comes specifically to joint pain and stiffness, those feelings in our bodies that, you get up in the morning. And I always think of children, they don't know they've even got a body, do they? They're just kind of,
Yeah.
running around, not feeling anything in the bodies. And then you start to get out of bed and start creaking and one thing and another. So what sort of lifestyle strategies can we implement?
Yeah, absolutely. Yeah, I can relate to that, getting out of bed and all of a sudden I'm hearing my mother's voice come out of my mouth, or lots of moans and groans about, making all these different noises that I didn't think I made before. What the things that we can do to prevent it, I think what we have to understand first is what's happening as we're going through perimenopause and menopause and how that's impacting our joints and our muscles, contributing to that stiffness, contributing to the pain, and even some degeneration of the joints in some way, shape, or form. So estrogen and progesterone that women are producing throughout our lives, as that decreases, it starts to decrease in perimenopause and then decreases significantly throughout menopause, they are protective. What we don't realize is that they do have an anti-inflammatory component for us. So as we're going through life and we're, indulging in certain things, food, alcohol, all these types of things that are I should say, processed foods or even ultra processed foods, alcohol, things like that, that are inflammatory, our body has a system to be able to keep some of that inflammation in check. Now, certainly if we go off the deep end and indulge in that too much, we're definitely going to, override that and have significant inflammation and feel the muscle and joint pain, mood swings, acne, all those things that can happen, anytime in life. But those can be exacerbated if we don't start thinking about how we're going to be changing what we're putting into our body while we have these hormonal shifts. And it's the hardest conversation that I have with patients, for sure. I'm in the Midwest, and beer and cheese is something that is regularly on the table, and sometimes for some people those things can be inflammatory, and we need to make some changes in order to go along with that transitional change of hormones that we have going on during those periods of time. And if we do that early enough, it's not, and in small increments over time, it's not such a big change if we fall off the cliff, because we have so many symptoms, we can't do anything about them. So that's one of the things. And then we can also get into, naturally optimizing hormones with supplements and herbs, and then of course, hormone replacement therapy.
So, I mean, this idea that we're in this fluctuating state in perimenopause, the levels are changing, but not, and the trend is in this downward direction. But for a period of time, there's a bit of fluctuation going on. And I suppose you kind of spoke to how estrogen has anti-inflammatory properties, but it's not just our female hormones that can be running amok at this time, is it?
No. So we've got cortisol, which cortisol is our stress hormone. And and this is true of estrogen as well, too, when cortisol or even estrogen are too high, that can create significant issues with our system. And also, what we don't think about often, we do think about it associated to estrogen being low, but if cortisol has been high for long periods of time, gradually, and all of a sudden the adrenals will fatigue or get exhausted, and then cortisol levels will actually come down to be very low. Not to the point where it's Addison's disease or anything medically related, but cortisol itself as well, that stress hormone, gets a bad rap sometimes, saying that, we've got to get it down. It's too high. That could be a problem. But in its sweet spot, in its Goldilocks spot, where it's nice and balanced throughout the day, it should be highest in the morning, then decrease throughout the day, so it's lowest at night. If those levels are good, that's also anti-inflammatory, right? So we want to be able to manage that throughout menopause, and we don't have a natural decline of cortisol unless we have significantly, I don't want to say abused, but significantly pushed ourselves to the point where we haven't managed stress well. And I can raise my hand because my cortisol levels have been low, and it's a struggle to keep them up, but I'm able to do that. I was able to fly through menopause without any of the typical menopausal symptoms. And my mom had horrible menopausal symptoms, And seeing that, I really made the changes early, but it started to catch up with me now in my mid to late 50s, Philippa, with joint pain and muscle pain that I was always able to control because of being a physio. But then all of a sudden I was like, well, wait a minute, what? Now I'm noticing changes that I really have to rethink other things that I can do to manage those changes so I can continue to be active.
Yes, yeah, and that's so important, this piece of the puzzle. And you and I have this in common, that living an active lifestyle is really high on our list of priorities. Being physically active. Our job is physically demanding, and we need to be fit to do the role that we do. I also kind of sign up to the idea of modeling the behaviors that I'm kind of encouraging my clients to adopt.
Exactly.
I don't want to ask them to do something that I haven't done or haven't tried, or benefited from. So it's interesting, actually, because the cortisol piece, as you say, is, I think, misunderstood, and that high cortisol, we're always trying to get it down. So I'm interested to understand, is this something that you had to monitor regularly to know what was happening? Because I know you've got this functional medicine qualification that you also bring to your repertoire of expertise. So, how do we go? Because I mean, knowing that what's going on in our bodies really then allows us to take the remedial action and to see the results.
Mm-hmm. So you can monitor cortisol levels. And again, we spoke a little bit before that our patients are often our teachers, right? So I would, see patients, and even I was experiencing severe fatigue myself after postpartum, after my son was born. And this was prior to me getting into the functional medicine and natural part of things. It was strictly sports medicine, physio at that time. And I went to conventional medicine. They said all my levels are fine. You're fine. And I'm like, look at me. I'm not, I had dry patches above my eyes and, dark circles under them. I was sleeping all the time. I'm like, there's gotta be something more. So that's when I dove into more of the natural aspect of things, because just because I was medically fine didn't mean that I was okay, and because I really couldn't take care of my son the way that I wanted to. And so that's when I started looking into the different types of testing and kind of got into more of the naturopathy. This was when I lived in Australia and became a master herbalist as well. Had a clinic there, and that's where I really went into the functional medicine aspect of things. And when I moved back to the States, picked back up my physio, and started doing pelvic and sexual health and women's health and the musculoskeletal as well too. So I think overall we've got to look at measuring those things. Blood tests, straight up blood tests, can look at our thyroid. They give us a good idea of what our thyroid function is. That was my issue. That looked fine from a medical standpoint, but from a functional standpoint, I wasn't fine. So I had to address that. We have a huge thyroid history in our family, so that made sense to me. So blood tests for thyroid were relatively straightforward, but when I looked at cortisol, through blood tests, it really didn't give me a lot of information. It does if you have something called Cushing's syndrome, where there's too much cortisol or very low cortisol addisons, that can be detected through blood tests. But when you're talking about more of a functional level where we don't have those medical conditions, looking at it through saliva testing throughout the day, or urine testing. I do more urine testing now than I do saliva. But looking at it 4 times throughout the day to see how our cortisol is shifting throughout the day, because we should have that shift. Cortisol is our excitatory hormone. It's something that stimulates us. So we want more of that in the beginning of the day, but we want less of that before we go to bed at night, so we're able to fall asleep and get our rest. As restful sleep is extremely important. So measuring your cortisol throughout your life, if you haven't ever had it measured, it's a great thing to do, just to get to see where you're at, and see if levels are lower in the morning than they should be. Then exercise in the morning can help boost them. So there's different things, there's different ways that you can address it if they're too high. And some people, my patients, will get a second wind, like they'll feel really sluggish around 1 to 3 p.m. and then all of a sudden 5, 6, 7, 8, they get this big, surge of energy, and then they have trouble falling asleep. So there's different methods that you can do, different supplements that you can take, even foods that you're eating at certain times of the day can be more stimulatory than others, or what you're drinking. So knowing those numbers throughout our life is really important, along with the estrogen, progesterone. So thyroid, cortisol, your estrogen, progesterone levels, even testosterone levels in females are really important to monitor all through our lives.
Yeah, and that's not something the Western medical system is very good at doing, sort of prophylactic. In certain conditions, yeah, we're screening for breast cancer, we're screening for, prostate cancer, whatever, but health optimization for us to function at our best and perform. And so many people are kind of existing in a state that has become suboptimal and yet are totally unaware of this.
Right. A lot of times my patients will have come to me for, let's say, might be joint pain, or, they want to lose weight before surgery or something like that. And we'll talk more about the functional aspect of things. And we start working on like their gut health, for example. The gut is directly related to muscle and joint pain, directly related to our hormone levels, directly related to our moods. So even starting to work on gut health to help them with their musculoskeletal or musculoskeletal issues, then they start to go, I didn't really realize how bad I felt. Like I didn't realize how little energy I did have until I started feeling like I had more energy. And, we get bogged down like this, especially if we have children. We just get busy and we just push through, and we're fatigued, and we think that's our normal baseline. And it doesn't have to be, but it takes time and takes effort to pay attention to those things when you do things prophylactically or preventatively. So that's the conundrum, right? How do we make time for ourselves, and still, have time for our family and our jobs and everything else that we're doing. So I struggle with that every day, so, and I'm in it every day. So.
Yeah. We are only human after all, and we have the same challenges as everyone else. Just because the theory doesn't make implementing the practices any easier than it would be for anyone else, really.
Exactly.
So I think that's an important point that we've raised, that hormones are this fluctuating kind of cocktail in our bodies, and that optimizing hormones isn't always about having more of them or less of them, but this whole recipe of hormones that is optimal across a lifespan. And for us to monitor some of that sooner, and then get a flavor of what it's like when we're feeling good. And then when we start to feel less good, we can sort of pinpoint where things are going awry. So I do love that idea. It's not necessarily what's going to happen. People will come to us, people will put off seeking help. They'll try and, as you say, muscle through. They'll try and think, oh, it'll go away if I just ignore this thing. And then it all comes to a head where they're not coping, and then they come and find a professional like me or you. And we're here to help and unpick those problems. But I think the thing that you've talked to is natural approaches and preventative measures. There are some generic preventative measures that will benefit us all, and that maybe testing isn't necessary in all instances. And that if we can optimize our health, and this idea of, I heard this term today, interoception, that is kind of really understanding and noticing how we feel on a daily basis in terms of our mood, our energy, whether we're rested, whether we're grumpy, whatever it is, but just being, whether we're in pain, whether we're stiff, if we are, where are we feeling this? Where's it coming from? And that's a real skill that I think is wonderful if we can have that opportunity to delve into a little bit of sensing within. And then when we take action, then we can notice more easily the things that make the difference.
Absolutely. I think I love that term, by the way. And you, I'm sure, run into this with your patients is we're trying to get them to have that interoception, right? To really pay attention to what they're feeling. And what they've been doing for years is trying to not pay attention to it because they have pain. They don't want to focus on it. They want to just get rid of it, pretend it's not
Yeah,
there, which
yeah,
then speaks
yeah.
up to them. So, it can be annoying for them, for me to keep going, what number out of 10 is that? How does that feel? Is that sharp or dull? Or because
Mhm.
they just don't want to think about it. But the reason why we don't want to think about it is because we place a negative label on it. We think of pain as bad. We think of pain as limiting, which it certainly can be. But we really, when we take that time to either see someone like us or even on our own, listen to our body and say, what is this trying to tell me? Right. So what message is this pain trying to relate to me? Because pain is good. I mean, I want to feel pain if I'm backing up and I don't know that I'm backing up towards a flame, right? A fire. I want to feel pain or want to feel some sensation to say, no, protect yourself, move away. That's normal. But we've been conditioned to dumb down pain so quickly with drugs, that we just pop when we have the semblance of a headache. And now so many of my patients are taking these medications that like NSAIDs, non-steroidal anti-inflammatories that will actually make their pain worse if they continue taking it in the long run. They're taking it preemptively so that they don't have the pain to feel. Now, you and I both know that if we can teach ourselves to move differently, we can also avoid that pain versus taking a drug to move in the same way that's causing the problem and then only covering up so then the pain and inflammation actually gets worse. But we've been conditioned so strongly to say, take this medication to prevent yourself from ever feeling any pain. And if I could share a story for you where it really solidified it for me was I was flying back to the US from Australia and we're, from Sydney to LA at that point in time. It was like a 14-hour trip and we were moving all in a bus, moving from one terminal to another. We were all tired, very tired. And across from me was a mother and a son. And I think I noticed them because he was about my son's age at the time, around 10 years old. And I was missing my son being away from him. So I kind of paid attention to them. And I saw that he had his head in his hands. And he said to his mom, I have a headache. My head hurts. My head hurts. So she rustled in her bag right away and grabbed a pill, whatever it was, and said, here, take this. And he's like, no, Mom, I don't want to take it. And she said, take it. And he said, no. And she pulled him close and looked at him like, and if your mom ever looked at you like this, you're in big trouble and you're going to do whatever she says next. Just take it. And he took the pill. And now if that was myself at home, 20 years ago, it was my parents, they'd be like, go play outside, go eat a banana, have a glass of water, things like that, where the water that he probably had, because we were all dehydrated, I'm sure our blood sugars were all low. The water he had probably is what helped his headache more than even the pill that she gave him. But we, from a young age, are conditioned to be like, oh, I have a ache, I'll take this pill. And those pills, if you take them in the long term, like I've said before, actually makes your pain hypersensitivity increase. So the pain actually hurts worse than if you hadn't taken them at all. And it slows down the healing. So they certainly have a place. I'm not against them, but to take them preemptively or in the long term can really set us up, especially in this transitional period of time, perimenopause and menopause, with experiencing more pain.
Yeah, and so that really, you preempted my next question, that people, as you say, are conditioned to the idea that the tablet is a solution. Not, I say people, lots of people are fed that information, is probably what I should say. And this can be hard for us, to what's the word? I don't want to use the word contradict, really, because that's not really what I mean, but to support people to adopt more practices that are more natural. And so movement is really counterintuitive if you're in pain. It really kind of is just mind-boggling to think, unless you experience it for yourself. And that, that idea of interoception, where we we do something and we notice, oh, actually, I feel better. And funnily enough, my husband was on a weekend with some university uh, oh, alumni. That's the word, I think, alumni at the weekend. And so, all these men who are now 60 years old, I mean, it's incredible that you get together, isn't it? And you all just feel the same as you did when you were 21.
Right. Mm-hmm.
But now you're 60. And one of the guys was saying, oh, my back. And my husband said he could hardly walk. And it was just a really acute, rye neck, rye back, whatever, had come along. And he was really struggling. But so they thought, what can we do? They were in Stratford-on-Avon, and there's lovely river boats there. So you can go on the river, and they elected to do some canoeing rather than go on a motorboat or anything. They were all there with a canoe, 8 men in a boat. The photograph was funny, I have to tell you. Anyway, so this particular chap who had the back pain was at the back, and he was paddling with the paddle one way, paddling the other way, one way. And my husband said he got out of the boat and he went, oh, I think my back feels better. And I thought, yeah, you're not kidding. Of course your back feels better. But for us to, I don't suppose he would have done that if he hadn't been, doing this
with the boys.
Yeah,
right.
yeah,
With the boys. Yeah. And it's really interesting. Motion is lotion, as we say, right? Movement is great. But we can feel like it is counterintuitive because we're trying to protect ourselves. But there's even research showing that the environment that we're in, like this environment with these 8 guys that were, alumni, they knew each other when they were young, where they put men, I think it was like the 50s, 60s, 70s. And then they had them live in a room that had like, pictures that they would have had 20 years prior, foods and played the television shows that were 20 years prior, and their pain decreased, their symptoms decreased because they were living in this environment where their belief was unconsciously that they were back in time. So combining things like movement and utilizing and controlling our environment. I mean, if all we ever do is complain about pain. I tell my mom, she's in an independent living center. I'm like, I don't know that I could live in an independent living center because everybody's just complaining about how horrible it is to be old. I'd be the one to be like, no, stop. Right. So,
you need to go. Yeah, that absolutely plays into it. You need to go and work in the nursery school when you're a pensioner with all the kids running around. But that I mean, that's fascinating. I hadn't, but the power, the power of the mind, and the fact that pain, they say pain is in the brain. It's a hard message to sell sometimes. The idea that the neuroscience of pain and the power of the subconscious mind to influence our experiences of life, and including pain.
Yeah. And those controlled movements that we teach people to do to improve and increase movement, increase the lubrication, increase the blood flow to allow them to have less pain is so important that they have that instruction on how to move, because otherwise they're just moving in a way that's going to hurt them and that's going to reinforce the pain. And we know the brain does change, and the neural pathways in the brain do change when you have chronic pain to, again, almost to the point, like I was talking about, the NSAIDs do to make you more hypersensitive. The brain is working overtime to protect you instead of allowing you to be able to move. So if we're able to help people move, I have a person who's going through menopause right now, and she's like, just complained about how horrible it is and how it stinks and how it's not fair and and she has knee pain, and it only happened when she was in menopause and the hormone changes, and all we did was change the way that she was walking up and down stairs, and she had no pain anymore. And she was convinced it was, I'm getting old. But it was just the shift that we needed to do in the biomechanics to, I know I'm speaking to you as the converted, but, get the glutes going, redistribute her weight on a different part of her foot, make sure her knee was out over her toe, just changing some biomechanics to decrease that stress on the area. So biomechanics are one aspect, hormones are another aspect, gut health's another aspect, and then mental health is another aspect.
Yeah, and this is the thing that I think of many professions, physiotherapists are very well placed in our training and our background. The time that we spend with patients that doctors don't have the advantage of, certainly here in the UK, to really delve into all these different facets of a person and not just condition. With all your amazing list of qualifications, that functional medicine piece, the the musculoskeletal piece, and there was something else you told me that I've forgotten. What was the other thing?
Well, the nursing, the functional medicine, physio, so gut health, all those types of things going together.
Yeah. So then, but honestly, patients come and they do want to lie on the couch and get a quick, rub down, don't they?
Yeah. Yep, exactly. The PT, then they start to realize PT isn't always pain and torture, but that can be the perception sometimes too.
Yeah. But I like what you said about how you move, because this is so important that that gets lost on people who haven't had our sort of training,
Mhm,
that the nuances of movement, and the fact that now in modern life people are becoming so separate from the bodies,
mhm,
so disconnected is the
mhm,
word, isn't it? So that we're somehow losing that inner sense of where we are in space,
mhm,
and how we're using our bodies as we go about our lives. And I think it is that pull from these devices that is just taking us so out of our bodies,
mhm.
um, and that's not helpful. So our job is to really help people to get back into the bodies, and with our expert guidance to move in a way that, as you say, is conducive. So we're going to nourish these structures, stretch them, strengthen them, whatever's required, and not overstress structures, and give people permission to move in a variety of ways, because there's no one way that suits everybody, is there?
No, exactly, and that's why taking a look at everyone, how they're walking, how they're getting up from sitting and standing, are things that we as physios, it almost becomes an obsession about how people are moving. Like, some people I see on the street walking a certain way, I want to hand them my card and be like, "Okay, you'll need me later, so just keep this." But otherwise, it's so important to be able to see that aspect, but then also move out of that aspect, because not everybody gets better just by doing certain exercises or just by doing the manual therapy. And that's where it's important for people to understand what's happening with their hormones, with their gut health, with,
Yeah.
their mental health, and how that might be impacting them physically as well too.
Yeah. And like I keep saying, if it was simple, we'd have solved the problem by now.
Exactly. They wouldn't be seeing us, right?
No, no. So, this is lovely chatting with you, I must say. I could chat all day, but for those women who are ready to take action, they've got aches and pains, they're maybe feeling menopause is knocking, or maybe it's well and truly knocked. What's one thing that they can do this week to move towards a pain-free midlife?
Great question. I wish there was just one thing, but I'm going to give one simple thing that pretty much everybody listening, I believe, can do. If you're driving and listening, don't do this, but it's something called diaphragmatic breathing. I suppose if you're driving, as long as you keep your eyes open, you can do this. So, diaphragmatic breathing, and even meditation, if you're into meditation or anything like that, research is showing that these things are upregulating the parasympathetic nervous system. Now, that's a big word for saying it helps our body rest and digest, right? So if we do diaphragmatic breathing, even at a time when we have pain, like joint pain, muscle pain, headaches, anything like that, if we breathe from the diaphragm, and there's a million, Google, YouTube videos about how to do it. But basically, it's instead of using the accessory muscles up here, up here, you're using your diaphragm to breathe, so that when you breathe in, your belly is coming out, and you exhale, your belly comes down, and you're not moving the muscles up here. If we do that for even 2 minutes, research shows that we're stimulating that vagal nerve, upregulating the parasympathetic nervous system. And that will help us release some of our own opiates, some of our own endorphins, think pain relieving molecules that our body makes on its own without any assistance. So that's one thing people can do. And what that also does by doing that is it creates that interoception that you're talking about. It really gets us feeling and being in the moment and just, letting everything else fall away, even if it's for 2 minutes, to be able to do that. If you do that a few times a day, that adds up to, how many times a week. And then you should notice within, a week or two that you're feeling better. That will also help you make better decisions about your next step and what you want to do, whether it's to see somebody like you and I, Philippa, talk to your doctor about different options of what you have out there, see a functional medicine specialist. It gives you that centered space to be able to make better decisions from as well too.
Yeah, thank you. That's a wonderful tip, and I echo that absolutely. Now, we've mentioned a few times functional medicine specialist, functional medicine, and for people who don't know what that is, can you just give us a sort of brief overview?
Sure, it can mean different things to different people, but it's kind of the new trendy term for integrative medicine, right? The new term for kind of expanding, more of a medical term for naturopathy than the medicine, that the medical environment is, they don't necessarily look at naturopathy as a viable way of addressing things medically. So, but all in all, what it is we're trying to look at you as a whole person to get you to function, if you will, at your best and most optimal, so that you can be as healthy as you can be and be as active as you can be, and I don't like to say happy as you can be, because happiness waxes and wanes, but be content and satisfied with the life that you have. And that's whether it's movement or, being able to sleep. Functional medicine experts talk about sleep a lot. Looking at optimizing hormone levels, looking at gut health is oftentimes in the functional medicine aspect, but really it's a holistic view of the whole person. But what I caution people about, for if you're seeing a functional medicine specialist or looking into it, is you don't want to see somebody that's just going to medicalize supplements or herbs or anything like that. Because then it's just, here's a symptom, you have the symptom, here's this supplement, you have a symptom, here's this herb. And then you end up with 20 different things that you don't know what you're taking, why you're taking them, you get frustrated and it's not working. You really want to find somebody who can personalize that situation to your blood test, your urine test, your saliva tests, to the symptoms that you're presenting with, looking at your family history, looking at your past medical history, and finding all those pieces of the puzzle, putting them together as and looking at you as one whole person. Not that everybody gets the same exact program. It's like a physio, right? If we just handed out the same exercise sheet to everybody, it's not going to be really helpful, right, for most people. So I'm sorry that that's such a big explanation about functional medicine. I hope it helps people open their eyes to what the possibilities are, because we are all those things I just talked about. We're a product of our gut, our hormones, our mental health, our movement, and so much more. So it's really looking at the person holistically, but be careful of the people who, have you buying bucket full of supplements and things like that if you don't know why you're taking it, then that's a problem.
Yeah, yeah, you're absolutely right. We can medicalize all these natural approaches just as easily as going to a medical doctor and taking ibuprofen. So yeah, that's a really important distinction to make. And I think as physiotherapists, here we go, banging the drum again, that that combination, I think, is so powerful that you have. And I would love to have, but not quite yet. Haven't studied enough yet.
Well, I'm going to be doing a course for physios and things like that about functional medicine in 2026. So I'll let you know when that happens.
Oh yeah, put me on your list. Yeah. So, but we, as physios, we've got this added dimension then to lay the hands on people, because sometimes there's a facet joint that is needing mobilizing, And this is in the spine, and, and symptoms can be manifesting from this stiff joint. And that, I always say, once I've freed it off, then you can go away and keep it moving. But some of these structures are quite hard to get at on your own body. So having your own body mechanic as well is just, to put those two things together, I think is really a powerful combination. And so, kudos to you. Absolutely. So tell me, where can people find you and your book?
Thank you. Thank you so much for asking. So my book, The Pain-Free Formula, Solving the Puzzle of Muscle and Joint Pain Without Surgery, Drugs, or Injections. And you're right, that's a big mouthful. Can be found on Amazon. And then my clinic name of my clinic in the States is NEWYOU, NEWYOU, healthandwellness.com. So they can reach out to me through the website. They can also find me on the Pain-Free Formula podcast. They'll see there's a couple other podcasts called the Pain-Free Podcast, but make sure it's the Pain-Free Formula podcast. You'll see my mug on the thumbnail, so that it's me. And that's where I try to every week just drop something. Sometimes it's as short as 10 or 12 minutes. Sometimes it's longer, like 45 minutes. Philippa, we'll have to talk about I'll have you on my podcast as a guest, so what we can talk about on there as well. But those are the main places that they can reach me.
Yeah. Well, it is a very informative podcast, and I was listening to it myself and learned a whole lot about olive oil that I hadn't really fully understood before. You explained it in such a really easy to digest, excuse the pun, fashion. So I am going to be medicating myself with olive oil. I already do in cookery, but you really made me understand why it's so good for us. So thank you for that.
Oh, you're so welcome.
It's wonderful to have met you. I'm so happy to have joined you. I'm so happy that you joined me here today for this chat on moving through menopause. And so if you've got any questions or comments, please let us know. You'll see this episode out there on social media. Drop us a comment. And please share this conversation with anybody you think might benefit from this knowledge. Stacey's absolutely full of knowledge and information. So thank you all for coming along and listening to us today. It's wonderful to have met you, and I'll say bye for now.
Bye-bye.
Bye, everyone.